My next guest and I have something very serious in common: type 2 diabetes. I was diagnosed over 25 years ago. 56-year-old Andre just 3 months ago. Now, Andre says he's always been a healthy eater and is very active as a fire department captain. So learning he has type 2 diabetes was, quote, a slap in the face. Take a look.
Division 2 is clear. You have another assignment. I remember that I'd come home from work. My wife said my body appearance had changed. When I went to the hospital, the doctor told me that my blood sugar was much higher than it should be. In July 2016, I was diagnosed with type 2 diabetes. Fire department captain speaking. I'm a firefighter, captain, and paramedic. It is a demanding job. In my line of work, we have a mandatory exercise program. I eat a very healthy diet, and I have a strict exercise regime that involves cardio, core work, and yoga.
What did you eat at the firehouse?
My wife, Keisha, she's more strict than I am. I had to change my diet to eat more proteins. I started exercising more than before. I'm concerned about what it would take to fully manage my condition. I want to live, but I have type 2 diabetes for the rest of my life.
Well, Andre is joining me along with Dr. Pamela Kushner, who has spent 2 decades working with people who have diabetes and is also a good friend of mine, so welcome. Glad to have you both here. So, Andre, as an active firefighter, did you ever think in your wildest dreams you would be diagnosed with type 2 diabetes?
Never. As a firefighter, I have to remain physically fit.
I would think so. So what was your initial reaction when you got your diagnosis?
I was stunned. I've always eaten healthy. I exercise. This is impossible.
Yeah. Mm-hmm. So I guess your mind soon turns to what I got to do. How do I manage this, right?
Correct.
Dr. Kushner, what is Andre's best strategy for his type 2 diabetes?
So first of all, let's recognize the fact that type 2 diabetes is a manageable condition. And one of the other things you need to remember is there's a lot of misinformation out there, and there is no easy fix.
Well, let's talk risk factors.
There are a lot of risk factors for type 2 diabetes, and the ones that I talk about commonly with my patients are not being on a healthy diet, not getting enough regular exercise, smoking, none of which Andre does, race, age, a family history of type 2 diabetes, high blood pressure, high cholesterol. These are some of the risk factors that are commonly seen in type 2 diabetes.
And have you had to make any lifestyle changes?
Yes, sir. I have exercised even more. I eat even healthier. I have to watch my carbohydrate and sugar intake, and it's hard.
Yeah, believe me, I know. I've been at this for over 25 years, and I had to really change the way I ate, because for me it was like feast or famine. Plus, I put together a great support system, and it began with my wife, Robin. She learned what my challenges were and what she could do to help me stick to my treatment plan. And it takes a full treatment team to get the right balance of diet and exercise, and in some situations, medication. And I've tried a few different medications over the years as part of my overall treatment plan, but since 2012, I've been using an injectable medication. It's not insulin, and I only have to take it once a week. It's helped me manage my blood sugar level. And this medication fits my busy lifestyle because I only have to do it once a week. But everybody is different, so you have to talk to your doctor about what treatment is right for you.
You're exactly right, Dr. Phil. That what's unique about type 2 diabetes is that this condition is really individualized for each patient. And so it's important to work with your doctor to come up with the right treatment goal and plan that is customized just for you. And you are not alone, Andre. There are 28 million Americans that have type 2 diabetes in the United States, and 86 million that are at risk for developing it. But what's interesting to me is the fact that the physical barriers are often well recognized, but people really don't realize the psychological barriers that can make it difficult for someone to stay on a treatment plan.
Yeah, and I have a unique perspective on this psychological stuff, and I did the research and understood the condition when I got it. That's why I got inspired, and I partnered with AstraZeneca for what we call the On It movement to help people with type 2 diabetes create a plan and stick to it. And as part of that movement, I have 6 rules to get on it and stay on a healthy plan. And one is move forward. And what that means is know that the disease is not your fault. And 2 is get educated, because knowledge is power. 3 is build a team to help manage the disease. 4 is you replace bad habits. And then 5, make a plan with the help from your healthcare professional and your treatment team. And then 6, stick with it. I mean, you can really be empowered by your plan.
And I want to emphasize, Dr. Phil, that if you have type 2 diabetes like Dr. Phil, then staying on it really means working with your physician to come up with the best treatment goal and plan that works perfectly for you. And that usually will involve a healthy diet, regular physical activity, and medication.
Okay, you gonna look up this 6-part plan I was talking about?
Yes, sir.
You gonna stick with it?
Yes, sir.
I'm gonna check on you.
All right.
All right, hey, thank you so much. Like Andre, take a positive step forward in managing your type 2 diabetes. Now, visit onitmovement.com today. Thank you for being here, Doc.
My
I really
pleasure.
appreciate it.